Hey guys, it's Tina from class. I've been a registered nurse now for 9 years. I've worked in the NICU for 7 years, and these past 2 years I've worked on Mother Baby. As you know from my previous posts, I was diagnosed with breast cancer last year. So not only was I having to take care of patients, I was a patient myself, dealing with my own challenges and difficulties. Compassion fatigue is a very important topic for me since it is something I've personally experienced, so I just wanted to talk to you about it. So what exactly is compassion fatigue? It is a significant depletion and exhaustion from providing compassion to our patients. By providing compassion to our patients, we also must remember to provide compassion to ourselves. So who is at risk and how do we develop compassion fatigue? Well, nurses are at a high risk of developing compassion fatigue. As compassion fatigue can occur in any setting, it mostly affects people in the caregiving profession. Nurses who work in the hospital setting, such as in the ICU, the emergency room, oncology, pediatrics, mental health, and even obstetrics, have alarmingly high percentages of compassion fatigue. As nurses work long hours and include caring for patients that are either in acute distress from pain, suffering, or even if the patient is dying, the nurse is not only having to take care of that patient, but the family as well during this difficult time, which can lead a nurse to feel emotionally fatigued. So what can compassion fatigue do to the body? As it can not only put a physical toll on the body, it can not only cause physical but emotional symptoms as well. Symptoms can include gastrointestinal and cardiac symptoms, fatigue, sleep-wake disturbances, anxiety, overactivity, depression, anger, and even irritability. As it can affect our work, it is important to remember that the nurse's ability to practice safe care can be difficult, as it can cause memory problems, poor judgment, and even the loss of concentration and focus. This can not only cause you to dread work or even certain patients you may be caring for, you may feel less empathetic and even avoid work altogether. Can you recognize compassion fatigue? Well, it is actually easier to recognize it in someone else other than yourself. Once you are able to recognize it, you must seek out resources to help you in your time of need. There are resources you can use through work, such as the employee assisted programs, or you can either talk to your supervisor, a counselor, or even a trusted friend or nurse you work with. The employee assisted program can help assist by offering a workshop to help you balance your work-life balance if you are having a difficult time. By knowing that when you are caring for patients on a regular basis, you draw on your own reserves to be empathetic. And if you do not take the time to fill up your own needs to nurture yourself, you will find yourself running on empty. So how can we prevent this from happening? Remember to eat a healthy diet, exercise, get sufficient rest, maintain family and personal relationships, engage in adequate leisure and recreational activities, and you may even need to attend to your own spiritual and religious needs. We all as nurses are motivated to put others first, as compassion is one of our central values of nursing, which is also one of our greatest strengths, even though it is never without risk. By recognizing that compassion fatigue not only leads to self-harm, but that it can also cause potential harm to our patients, we must be motivational enough to recognize and value and prioritize the issue for the safety of us all.